Hello, I'm Dr. Michael Mendribil. I'm a naturopathic physician in Greenwich, Connecticut, Coscob, Connecticut. I've been practicing in Connecticut now for, wow, 21 years. And over that time, I've seen a whole lot of patients. One of the things that's concerned me, and the reason that I'm speaking to you today, is that I would like to ask for your support for the modernization of the naturopathic scope of practice here in Connecticut. Right now there is a bill in the Public Health Committee, and hopefully soon will be on the floor of the legislature, HB 5534, that is outlining a means for naturopathic doctors to get prescriptive rights, as many of the naturopathic doctors in other states do have. For instance, Oregon, Washington, Arizona, for example, and Vermont. Naturopathic doctors in Connecticut do not have this right yet. And the reason that I believe we should be advocating and supporting this legislation, that the people of Connecticut should have it, is because, funny as this may sound, I think patients are on too many medications. That's right, too many. So I believe that naturopathic doctors are uniquely positioned to help reduce the amount of medications that patients rely on or must take, because they can employ other therapies that aren't available or that the practitioners in other medical disciplines do not have. Over the years, I've seen people be able to get off their medications using natural therapies, but unfortunately, I couldn't manage that. I couldn't write prescriptions to wean them off certain medications that I didn't believe were no longer necessary. So I think naturopathic doctors should have prescriptive rights so that we can help those patients take less medication. And I think that the people at large want this. I think it would be beneficial to our healthcare system. It would definitely reduce cost. The other thing that having this prescriptive rights for naturopathic doctors would do is it would reduce the duplication of services. I've had to send patients to other doctors to have them manage their thyroid medication, for instance, a condition that I diagnosed, but our natural therapies weren't quite strong enough to fully treat the disorder, so we needed a prescription for a thyroid medication. So in that situation, it's like the patient would have to pay twice, the insurance companies would have to pay. It's a waste of time for the patient, and it could be dramatically reduced, that duplication of services if naturopathic doctors were able to prescribe as well. That's another big important reason. And one of the fundamental reasons, again, back to my main point, is that I believe that there's too much medication in most people's lives, and they're taking too many drugs. We can reduce that, so we need the prescriptive rights. So the University of Bridgeport would also benefit, and that would benefit the patients, the thousands of patients, many of them needy and lower income, that need and benefit from the naturopathic medical services offered there at their clinic. So again, I'm Dr. Michael Mendribil. Please call your legislators, support HB 5534, an act concerning naturopathy. Tell them that you believe that naturopathic doctors should have the right to prescribe nutritional, not only nutritional supplements, but pharmaceutical medications, the ones that are listed in the bill, and not excluded. Certainly there's medications that we are not asking to be able to prescribe, but the ones that we think we are highly qualified to do that, and with ongoing training and continuing education, we will be at the top of our game with that. So again, I'm Dr. Michael Mendribil. Thanks for listening, and please support this kind of legislation, because it could be and make the difference for you and your families. Thank you.